Good morning, everyone.
No, wait, let's do that again. No, I'm just give me more feeling.
I am Linda. Actually, yesterday was my 4-year anniversary since I had my surgery. And thank you. Best decision of my life. I lost 150 pounds. Am I not in there? I'll stand back here. I'm sorry. I did lose 150 pounds. My highest point was 287. So I actually weigh less than 150 now, so I lost more than half of myself. I have some pictures. If
yeah, let's see for the camera. Okay.
Sure, you can
see here
do it, or I can hold it and pass it, or.
Okay, so that's the old you, and then
that's the old.
Here's the new you. Yay! Congratulations! You look great.
Thank you. My surgery was 33 minutes. He bypassed about 7 feet of intestines. And I think one of the main concerns of mine was that I wanted to make sure that there was going to be just one time. I didn't want to go back in, to have a revision, to have more done. And then even some people have too much done, and they have to go back for a revision to be able to lessen it so that they can gain some of the weight back. Well, Dr. Rutledge did wonderful on me. I'm right at where I want to be. I actually, losing the 150, and then I gained back probably about 8 pounds in the last 3 years, I suppose.
And over 10 years, we have 10-year data now. We see about 10 or 15 pounds gained over the 10 years, so that's expected.
10 years. Mm-hmm.
Yeah. Now we have a less than 5% that gain more than that. So there are some people that gain more than that. Usually they've had children, which is a big thing for affecting your hormones. Another thing is they put down different medicines like prednisone can cause them to regain their weight.
Okay. One thing that I did find out is you'll know that you always have to take lots of vitamins. And I don't know if you found this out, but we did some investigation. You always talked about One Source vitamins at Walmart, and they discontinued making them. Well, we tracked it down that line had been sold, and now it's the same company, it's the same ingredients, and they are at Albertsons, and they're called Women's Mega Select. There's probably another kind for men, but Women's Mega Select on Equaline, and these are at Albertsons. So if you want to remember that, because I did a lot of searching around and none of them had the same ingredients, and my husband went online and actually talked to them, and they said yes, they had broken the contract with Walmart, and now it's Albertsons. So you'll want to take lots of vitamins, you'll want to drink a lot of water, you'll want to eat salt, and I know that's crazy because you grew up saying, oh, don't put extra salt on, especially if you're overweight or if you have high blood pressure, which I did, but now you're going to want to have extra salt. Ask me a couple of questions. It's been 4 years now. I can't remember all that I've said in the past. Anyone have questions?
Well, one thing is there's new research on vitamins.
Okay.
And so I will, after you're done, maybe I'll go give you a little update.
Oh, okay.
And all the things I told you about vitamins are kind of true, but it's a little different.
Oh, okay.
So there's been new research on vitamins. Actually, that was the little video on the iPod Nano that I was showing.
Okay.
Basically, up to including just yesterday, there's more research that sometimes the idea of taking bunches of vitamins doesn't really help, and there is a little hint of research that taking lots of vitamins may actually be dangerous.
Right.
So I'm going to go over a little bit of that with you since you haven't heard the latest from us.
Okay.
And we have to keep talking about this because it's an example where I was wrong. And my push to take lots of vitamins now has to be kind of turned down a little bit. I used to be, as you know, Mr. Take Lots of Vitamins. And there's a lot of good research, or a lot of bad research, depending on how you look at it, that's changed that a bit. And I'll talk about that after we're finished. Okay.
And I did find that out from blood work that I've had throughout the years, that they said, well, why are you high on this and high on that? So decrease this, but add more of the vitamin D, but not...
Right, and I'll talk about vitamin D also. Hot new research on that, and also some disappointing research on taking tablets of vitamin D. So if you'll remember, after we finish maybe talking to the folks who are here, there's new stuff. In the videos on the internet, I call it bad news about vitamins. And on the other hand, it's good news about eating a healthy diet. So we'll kind of talk about that, and it's new since you were here, so it's good to maybe to kind of have an update on that.
Good. Another thing that was exciting to me was that I never feel deprived anymore. I've been one of those dieters where you could lose 20 pounds and regain 30 pounds. Anybody else done that? Oh yeah, our whole life, right? Where you almost starve yourself for weeks, and then it seems like in 5 meals you've gained it all back again. You're not going to feel this way anymore, and you're not going to feel deprived, because you're going to eat what you want to eat, but you're going to automatically eat a lesser amount because you're not hungry anymore. I always love the story of Greenland. Make sure you study about Greenland, because it gave me permission to know why I was hungry. Because I always felt like, why am I hungrier than the person sitting next to me? And there really is a medical reason for that. You know, sometimes doctors or other people will tell you, well, you just don't have enough willpower, or you just don't scoot away from the table, or you have learned bad habits from your family. Well, there really is a medical reason why obese people are obese. I liked knowing that, and he gave me good reasons to know why I was at the stage I was at. Well, now I can eat a saucer full of food, and I feel like it's Thanksgiving dinner. Does that sound impossible? It almost does, huh? But I can eat. In fact, we went out to dinner yesterday. Yesterday was my birthday. I had my surgery on my 52nd birthday. I am now 56. People look at me now and they say, you look so much younger. And I say, I just lost a lot of weight. But people all the time say, well, you've lost, so much weight, but you look like you're about 10 or 15 years younger. So that's another nice side of it. Another thing, too, that affected me were the hormone levels that changed. I had already...
You were on the patch for a while, right?
I was on the patch for a little while.
Right.
And meaning the patch, meaning the hormone patch.
Either you were in the car or I was in the car, and you were a little tearful.
Yes. And I said, why am I feeling like this? I'm losing weight and I should be happy. And he said, well, did you put on a patch, a hormone patch? And I said, no. And he says, well, you've got the prescription, put on a patch. And then I ended up, even for a little while, had to put on a second patch. I had already gone through menopause, and the patch made a few changes, which kind of freaked me out too, because then all of a sudden I started again, and I'm like, ooh, where did this come from? But he reassured me that that was, part of the hormone thing too. I did it probably 2 months, at the most.
I think I remember that.
And then fine again. So
there were a lot of kind of tense.
Wait. Started your period?
I did.
Did you really?
I did. Yeah.
Yeah. Let me give you a little summary on that. We say that the surgery can roughly be kind of described as giving you 10 years back in time. In other words, you're almost 10 years younger. And we've had people's vision go back in time. We've had their blood pressure go back in time. They say, I look this way, different kind of things. But if you take a woman who is after menopause, back 10 years, sometimes we'll get phone calls where people are not happy to go back. They're not happy with me taking them back.
But we're just really surprised. We're like, whoa.
So don't flip out if there's...
Yes, don't flip out over that. So.
Do.
Right, if it starts up again. The other thing is that can happen, many women who are overweight cannot have what's called polycystic ovary disease or polycystic ovary syndrome, and with that they can have infertility. And when we operate, we can suddenly make a woman who's infertile very fertile. So, heads up. Because we've had some, again, surprise phone calls saying, Dr. Rutledge, what did you do? And I said, listen, I had nothing.
Well, I won't take any longer unless some of you have questions.
Well, they might have questions. Who's having surgery this week?
Jenny is. My good friend Jenny.
All right. So, what they might want to know about is right before surgery, were you a little nervous?
Oh, yes.
Yeah.
Really nervous.
And was the IV a big deal? Do I remember that right? No?
I don't do good with anesthesia.
Right.
And I had a really, really hard time coming back around again. It took me about 5 days. I wasn't one of those that got out of the hospital and went shopping. I just had this cloud over me for about 5 days and nauseous and everything, and I remember thinking, oh my gosh, what did I do here? This
So
is
you're
not a
pretty
good
down
state.
about the surgery and have that. And then when we hear that, if we have somebody who's gone through surgery safely and hasn't had a complication, and then we find that they're tearful or sad or frightened or worried, that's when we think estrogen patch. And I think I do remember some little tearful calls. But what about pain? How about pain for the surgery?
No, pain was good. Right at my, would you
Did
say,
you have any
pardon
pain?
me?
Pardon me?
You want me to
Excuse
repeat
me?
that?
Pardon me? No
pain.
Okay.
My tummy was tender
Right.
if I bumped against it at the kitchen counter or something, but not pain. Not pain at all. And again, it was 33 minutes, and then it was in the recovery room. I was out the very next day. I was able to mobilize and move around. All of that was wonderful.
But you didn't feel like yourself.
I didn't because of the anesthesia, but I've had 2 other surgeries and they did the same thing too. So it's just I don't do
Now,
good
since
with that.
her anesthesia, we've actually changed our anesthesia, and if you are interested, we can go over the new anesthetic techniques that we use. Is called opioid sparing or less narcotic type of anesthesia that we use. Other people are oftentimes worried, oh, will I wake up during surgery? And they saw the movie where there's the guy who woke up. Did you wake up during surgery?
During surgery?
Yeah.
Oh, no.
Okay.
I hardly woke up afterwards. And I was
cool.
scared about that, too.
Yeah, we're cool with that. Right.
But
a couple of days of just being a little sleepy, I'll take that over being awake with pain.
Exactly. No, that part was all great. I do want to say that I've always referred to Dr. Rutledge as my friend. I feel like he was my rescuer. I had prayed many times of, what can I do to lose this weight? My blood pressure was high. I was on the verge of diabetes. All of my siblings, my parents were very obese. And I knew that I was going down that path. Remember, I weighed 287 when I first started looking into this. And I always thought I had big bones, but I don't have big bones. In fact, my ring size is a 4 1/4 now. I've had to size it twice. But I, again, have always recognized Dr. Rutledge as a good friend. Now, he hasn't seen me for a while because I haven't been to meetings. But as he walked in and he looked at me and he said, well, Linda, how are you? He remembered my name and he did my surgery 4 years ago yesterday. I know that you can call him when you need to. If you're in tears or you're afraid or you just want to talk to him for a minute, I still to this day have his phone number in my cell phone, and he will be the first one to give it to you because he's not one of those doctors that's going to sit behind the scene and then say, okay, don't ever contact me. Call Sandy first. I called Sandy too.
I'm going to have to edit this out of the video. Call Sandy. Call
Linda,
you're killing me.
But he is excellent, and he will always be there for you. And you have a family group here. We will always be here for the meetings to give you encouragement, to be by your side. Numerous times I have been, what's it called?
The
support group for the 10, but you don't do 10 letters anymore. You only do 5. That's what Jenny told me. 5 now.
We eased up.
See, it's even getting easier.
Yeah,
so,
didn't seem easy to them, but they don't remember the old days.
The old
days. We had to walk
with the
uphill both ways to school and
in the snow barefoot.
That's right. It was hard.
So, any questions for me?
How long did it take you to lose the weight?
I lost 115 in the first year. Oh man, was that exciting to just see the first month I was down something like 30 pounds, and then the next month I was down another 30, and it was great. In my book, and this is something that I really encourage you to do too, is log everything. Log your weight, log your pictures, so that you can see yourself, your progress. Again, that's why I can look at that and say, oh, at 9 months I had lost however much, at a year I had lost this much, and do that with the pictures. It's really fun because someday you're going to look at those pictures and not even realize that that was you too. And so anyway, do log that. It's a good guide to see how you're doing as you do.
The average weight loss follows a logarithmic decline. So there's a big drop, medium drop, tiny drop, and then kind of slowly come in for a landing. Now, there are patients who get really tense because they don't lose anything for the first week or two. And boy, does my email and telephone go off for that. But particularly people who are on diuretics for blood pressure. Anybody on a fluid pill for blood pressure? Yeah. Oh yeah. Were you slow losing first? I forgot.
No.
No. Okay. But sometimes people who are on a fluid pill will go days or even weeks before they lose anything, and they'll be really tense about it. So if you see that you're slow about losing, one of the things we say is, how much have you eaten in the past week or the past month? And they'll go, nothing. Well, you know, you're probably going to lose. So, but we get people who get a little worried about it.
Mm-hmm. Well, being on diuretics before, the water pill, lots of different medications that I was on, I am no longer. In fact, my high blood pressure has gone to where now I have to make sure it doesn't get too low. Mm-hmm. And so you'll learn your body, you'll learn how you feel, and if you're about to, you know, feel like you're going to just fall over, that means you need some salt. You would put some in your hand and lick it fast, or drink some Gatorade or something, because you will find that you do need extra salt. Yes?
Do you still have a dumping syndrome if you eat something you shouldn't be eating?
You can, yes, and I do. In fact, I've noticed if I eat ranch on a salad, now this isn't just one thing, this is this entire meal. One time I had ranch on the salad, and then they brought out the bread with the oil, you know, and the little seasoning, and then I think I had a little bit of fettuccine with it, and then I had something else, or it was like sour cream on something, and yes. Yes.
Did you ever see the scary movie called Alien, where the little monster comes out of his tummy? That's what you can get. If you have that bread, the ranch, and the fettuccine, that little guy that falls into the gut, which is not designed for it. The small bowel is not supposed to get food until it's been in the stomach and partially digested. And when raw bread, oil, fats, and particularly pasta drops in there, especially if it's Alfredo fettuccine, it sits there and it acts like a sponge. So the water moves in to fill that space, and all of a sudden you can feel the little monster trying to get out, and it can be real uncomfortable, and it can be a terrible experience. That's called type 2 dumping. Type 1 dumping is sugar, and that happens if you have what is the standard lunch in North Carolina, where I spent 20 years, and that's an RC cola and a moon pie. And if you have that for about a half an hour, you're like ready to take on the world. But about an hour after that, it's like nap time. And that's when your sugar can go low. In our patients, the sugar levels can go so low after some of that that you can pass out, and it can be even dangerous. So you want to be cautious in the future, and that's why we put our patients through the pre-op education process. It's a very serious procedure, medical therapy to own for the rest of your life. And it means that not everybody really is smart enough, intelligent enough to own a mini gastric bypass. It's got a potential risk because it's so powerful. And again, if you think about it, I like to think about obesity as an adversary. You know, it's our enemy that we fight every day. And most of my patients have fought that battle every day and failed. They've come up against obesity and diabetes and things like that and failed. Now the MGB wins. It is successful in taking down that, I would say, adversary or enemy. But it's got to be very powerful to be effective when diet and exercise and medicines and all those other things have failed. And it is very powerful, but it also has potential risks.
Well, what he does is he normalizes us to where we can sit to the person that's next to us that's thin, and we eat about the same amount. So
you're like your thin friend, you know, the annoying
you don't hate
friend,
him anymore.
Right, the annoying friend you go to lunch with or dinner with, and they pick at their salad. They have a little bit of their steak, a couple of bites of their side while they talk to you, and then they have one bite or two bites of a couple of the desserts, and you just hate them.
But don't go to buffets anymore, because you're not going to get your money's worth. Okay? Go only to places where you can take probably at least half or maybe even more than half home. I have taken things home and eaten it on 3 different meals. And you know, here in Vegas, they just oversize everything, which used to be really exciting because, wow, look at all this food that I have. And now you just know you're not going to eat all that. But I still am not a waster. It's really hard for me. It's probably just my upbringing. You don't throw it away. So
there's starving children in China, so we should eat it. Keep going.
It's okay if you do throw it away. Me personally, I still don't, but I make sure I take a container home and I'll eat on it 2 and 3 times. So anyways, the exciting part was that I was a size 24, 26, and now I'm a size 4, size 6. And let's just see me again. Yes, I still have flabby arms. And I don't know if I'll ever do surgery again because I don't do anesthesia well. But the rest of me, I feel really good with myself. I've got a thin little waist now that I didn't even know I had a waist for so many years. And it's just awesome. Do whatever it takes to get your money together because you just are buying yourself life. And you want to be around to raise your kids. You want to see your grandkids. And if you're at the health condition where that's a high risk, then there is no cost. There is no price on it. You'll do whatever you need to do to bring that money together. So if you don't have any other questions, thank you.
Thank you, Linda.